We are from the School of Digital Media and Infocom Technology, Singapore Polytechnic, and we are here to present to you a mock-up scenario of LifeLine Mobile Application. The LifeLine Mobile Application is aimed towards the field paramedics and the doctors at the A&E departments in the hospitals. Let me put up a mock-up scenario for a better understanding of the LifeLine Mobile Application. At 1500 hours, the Singapore Civil Defence Force control room operator receives a call from the Mass Rapid Transit staff regarding a casualty having breathing difficulties at Dhoby Ghaut MRT station. Onlookers are curious as the lady has been clenching her fist to the left side of her chest and is unable to communicate due to breathing difficulties. Paramedics arrive within 7 minutes and realize from the symptoms that the lady had been portraying and conclude that she is suffering from cardiac arrest. Paramedics send the lady to the nearest hospital, which is in this case, the Singapore General Hospital. A paramedic starts using the LifeLine mobile application by entering his login credentials when he commences his duty. This is the page where a paramedic will enter a casualty's NRIC identification number. Information such as the casualty's name, gender, and medical conditions are displayed for the paramedic's view. The next tab, which is the current tab, is the most important feature on LifeLine. This is where a paramedic will enter the current distress type and the symptoms of a casualty, the Glasgow Coma Scale, which is a medical scale, and the required vital signs of a casualty. An image of the casualty or the incident location can be taken by the application and added to the report. Once the paramedic hits on the activation button, a push notification is sent to the doctor's end of the LifeLine application. A submitted preview of the report by the paramedic will be displayed after the activation. With the assistance of Google API, a paramedic will be able to view an estimated time of arrival to the nearest hospital with the aid of a real-time route map. Moving on to the doctor's end of the LifeLine mobile application. A doctor logs in to the application using his login credentials when he commences work. The push notification sent earlier by the paramedic is displayed on this screen, stating a new incoming patient reaching the hospital. A doctor accepts the push notification and taps on the incoming patient button. Once he does so, he will be able to view the report sent by the paramedic. The doctor will now acknowledge this patient, and the doctor will be able to view this patient under his purview of patients. He will also be able to view past medical records of the patient to understand the conditions of a casualty further. The doctor will now be able to discharge a patient out of the A&E department to a general ward by filling up a medical transcript, which is now available within the application. He taps on the discharge button and you will realize that the patient has been discharged by the doctor from the A&E department. This concludes the LifeLine mobile application for the field paramedics and the A&E doctors. With LifeLine, we can save more precious lives.